That is one of the central issues in modern business, and it's a brilliant article written by Jennifer Schenker, who's one of the great business journalists that happens to work for us occasionally. So come up, guys.
I'll shoot you an email. Okay.
So this time, okay, yeah, that's good. Good, thank you.
These are two big dudes.
It just dawned on us that we're the only two people in the room wearing ties. So there's a couple more.
Thank you.
There's this.
It's the serious demeanor.
This session is different than the last one in that the last one was about the system, and this is more about the practice of medicine, although the two topics obviously intersect and overlap quite a lot. And up here I have with me Brian Donnelly, who's Chief of Staff at the Cleveland Clinic and is what kind of surgeon are you?
Orthopedic surgeon.
Orthopedic surgeon who has done a lot of work in administration of healthcare systems. But the Cleveland Clinic, as has been mentioned a number of times during the day, is really an extraordinary American, success story, and really just is a center of excellence in so many things. And Dr. Donnelly, Brian, is really involved in a lot of that. And so we're so happy to have him here to join us also with Brent Schaefer, the CEO of Philips North America. And Brent, you spend so much time talking to so many parties in the system. I mean, I'm just curious any thoughts you had about the last conversation or, your assessment of how, the attitudes may be shifting in the ecosystem of particularly providers who are a lot of your customers, right?
Yeah. Well, it was very interesting to hear that because those are certainly the big topics. And I'm glad they addressed all the easy ones and left us. But I think we know what you can't miss as you go across the United States. And really, it's not only the United States, it's the world. But you have aging populations. You have, as they age, you take the United States, 75 million baby boomers aging, coming through the system, who are going to have an increased needs, and we need to address that as a society. As they age, there tend to be higher incidence of chronic conditions, and this is something we have to think through. So this whole discussion about working across the continuum, delivering care across the continuum is certainly one of the big themes, and I think it's a challenge for policy, it's a challenge for reimbursement. The technology in many cases is there and makes it possible, but lining up the care delivery is what we need to do now.
So as a healthcare technology company, you would say the technology is increasingly going to be there to reduce the cost of healthcare. It's just a matter of applying it and understanding how to integrate it with the existing systems. Is that overgeneralized?
Well, I think that's true. I think it's moving very quickly. And I think in many cases, the technology is not the barrier. It's how we think about it, how reimbursement works, how we deliver care. And our goal is to work with key institutions like the Cleveland Clinic and other thought leaders to help develop those solutions so that they can address those issues.
Because sometimes you can do things, but there's no reimbursement structure for it. Is that part of the problem, kind of thing? When you're really doing the right thing, it's the right thing for the patient or the person, but it's not so much a reimbursable code.
Maybe I can answer a little bit on the provider side. I think that can be a little bit of a barrier if you take the short-term look. But I think if you take the long-term look, and some of the previous comments were about for-profit or non-for-profit, and I actually think healthcare from the provider side clearly is a non-for-profit and sees a mission-driven orientation to our work. So when you take the long-term approach, I think you can fight through many of those barriers.
And is Cleveland Clinic taking a longer-term approach?
Absolutely.
Is that one of the differentiators you're trying to bring to it?
I think we do take a long-term approach, and I would say not just us, but I think across this country, and I think to Brent's point, across the world. Yeah. We need to take a long-term approach, and the three approaches we take are, we have a constant focus on how to improve access. We have a constant focus on how to improve quality. And in healthcare or in any industry that you're in, as you improve quality, it's our third focus is reducing the cost of care. And cost always goes down as quality improves. And I think across the continuum, you see that. You see that, keeping people healthy. You see it in the acute setting, and you see it in the post-acute setting, monitoring at home.
So this does go to what we were saying before. You would think, really, that we will apply tech and we will reduce the cost of healthcare in the United States, regardless of what happens with the payment structure. Is that a fair summary?
I would say more than I think your quote was, I think, we must use technology to reduce the cost of care, improve the quality, and we will be able to do that.
We will.
To the earlier point, though, that we must collaborate. There's some complex problems that all of us face here in healthcare, and we must collaborate with industry, provider, payer, and the disruptive innovator. It's the only way we're going to solve this problem.
I think that's if I may,
Yeah.
I think that's such a key point because, in our past, and maybe what we're used to somewhat is selling the widget, making the device. In what we're talking about here, it is much longer term, right? So if we're going to deliver solutions to these problems, you really have to have shared goals, shared mission, a shared understanding of what problem it is you're trying to solve. It's not something you do in a month or with a single device. It takes sustained work, and that's one of the things we're trying to do as a company, is partner with key providers to help make that happen.
Maybe I can give you one example.
Okay, yeah, examples are good.
So we've had a focus on our internal medicine patients, so our general patient population, on blood pressure. And so we've used technology to try to decrease the blood pressure problems in our patients, to have better control of blood pressure. We use technology with texting patients, contacting patients proactively. We're able to increase the number of our patients that have better blood pressure control from 67% to 73%. That may not sound like a large increase of 6%. Our goal is to get to 90%. But with the 6% that we increased, we had 160,000 patients. That's 10,000 patients over 2 years that had better blood pressure control. And if you look at that data, that's 131 people who did not have a stroke. That's 71 people that didn't have a heart attack, and it's about 70 people that didn't have earlier death, just by increasing that using technology.
Just a small percentage
Small
increase.
percentage. So you can imagine, as we would move that to 90, as the country would move that to 90, and it can't happen without a partnership with industry, with a payer, and with the innovator working together.
That's a great example. And just let's put another example similarly next to it, Brent.
Yeah.
You were talking about, I think the thing in Banner, is that the one?
Yeah, so it's a related kind of example, I think. So some work, Banners, if you don't know them, in Arizona-based, a big system, very well-run system. So we did some joint project work with them, looking at providing care across the continuum. So and really looking at reducing hospital readmissions, and specifically for patients who have chronic conditions. And so they really looked at how they were delivering care in that setting around specific conditions. We brought the technology and the tools to help do that. The combined output was, this is a clinical study, it's been released, it's been published, but there's about a 40% decrease in readmissions, wow, and about a 30% decrease in overall cost, and about a 20% increase or decrease in mortality.
20% decrease in mortality.
Yeah. So
and that's, no, but to do that, if I understand correctly, you had, basically there were medical professionals who had almost like a dashboard that was giving them readouts of what was happening with the patients. I mean, tell us a little more about the system that enabled that.
Well, it's really, it's connected care, right? So it is, if you're familiar with an eICU concept of a kind of a control station looking at ICU monitored patients and watching for change in their status, it's applying that kind of concept all the way into the home, so that it's somewhat predictive and watches for changes in the patient's status. And then the key is, what do you do about it? Once you see that there's going to be a change in the patient's status, how do you intervene? How do you treat them so that they're don't have to be rehospitalized and treated in that setting? So that's really the concept, and it's exactly as you said, the key is working together to find a good path where you can make a difference.
So the patient is wearing some form of monitoring device, could be a variety of different things, but that then generates data that's going back to the healthcare provider. They're looking at it, they're applying analytics to it through software,
That's
right?
correct.
Okay, yeah.
Maybe, David, I can give another example. One of the earlier comments was, taking the long-term approach opposed to the short-term approach.
Yeah, I wanted to get to that, yeah.
So, a long-term approach that we've taken is we've developed a mobile stroke unit. So, in order to treat patients who have a potential stroke. And so, we outfitted an ambulance with a CAT scanner. So, the CAT scanner sits on the ambulance. When a call comes in for someone at their home who potentially has a stroke, the EMS from the city will then send our ambulance that has a CAT scanner on it out to the home. If it's a potential stroke, one of the biggest determinants of how people will do is if they have a clot that's blocking the blood flow to the brain, you can break up that clot with a drug TPA. The number one determinant of how a patient will do is how fast they get to TPA. So by sending this out, actually the patient will get a CAT scan on their driveway. Using telemedicine, the information goes to our neurologist who's sitting there, reads it, tells them right on the driveway, start TPA. And we've had some remarkable results. We've had patients who would have permanent mental and physical disability for the rest of their lives actually go home the next day.
Wow.
And you talk, I mean, that's a tremendous cost savings, but I think more important from a provider standpoint, we're really thrilled with the improvement in quality. And the long-term approach on that is that what we've committed, that it's always about what's best for the patient. And so that patient, we always take them to the nearest stroke unit, whether it's our hospital, whether it's one of the other hospitals in town, so that's not a short-term, the reimbursement model we're concerned about. We're concerned about what's best for the patient and what's best for the long term.
Well, that latter thing might not be shared universally in the industry, but what about, do you think that, this is what is exciting when I hear these examples, do you think that the knowledge of this kind of capability is spreading and will spread quickly? I mean, because these are pretty powerful, both of those examples are very powerful. I mean, they're fundamental, essentially short-term cost savings, right? Despite the fact they have long-term benefits too. I would think that's almost irresistible for other systems. Is that, do you think, either one of you, that we're getting a kind of to a tipping point where people are saying, we got to do this kind of stuff more? Because frankly, as a patient, I don't see it in my family healthcare situation, to be honest.
I guess I can't speak for all providers. I certainly think we're moving towards the tipping point. I'm not sure how close we are, but I think the comment earlier is the trust that needs to be built up among the different important aspects in healthcare that can improve healthcare. And as fast as we can develop that trust, I think is as fast as we can get to the tipping point and move forward.
I think you do, in addition to that, which I very much agree with, I think there are some drivers across the United States you see. So one of the things you see, trends, is you see a lot of consolidation of health systems, right? So it's at the rate, mergers and acquisitions are at the rate about one of every 4 days.
Wow.
Hospitals buying up other hospitals, getting bigger. As they do that, what they're trying to do is then standardize operating procedures, find efficiencies, find ways to deliver care that are more efficient than you would as a standalone hospital. So it drives you to that creative thinking of, how do I start to do this? What kind of tools do I need? How can I use, it's kind of the industrialization of healthcare, if you will. How do I start to have standard processes, care pathways we talked about? And what kind of tools do I need to deliver on those effectively?
And to that point, these are the lessons that have been learned in industries throughout time that are coming to healthcare. Reducing variation, it always improves the quality and it always reduces the cost.
Well, we've also heard a lot today about the dawning awareness on the corporate insurers of their employees that the cost curve has got to slow, right? So they're going to be putting pressure on the systems to save money so they don't have to pay such high premiums. I mean, these numbers just do keep ratcheting up. So,
I'd be happy to comment about that, because that's exactly right. And I think in many ways it's our responsibility to our businesses to help figure out how we do bend this cost curve of healthcare cost. It's been mentioned several times today. At the Cleveland Clinic, we put a large focus on that about 8 years ago, promoting health, promoting care coordination. We have about 85,000 lives in our employee health plan, and we saw costs increasing significantly. Over the last 5 years, with our efforts around care coordination, around promotion of wellness, around different programs engaging our employees, we've actually just now started a decrease in the cost of care. So we've actually seen the cost of care go down by 2.2% over the last 5 years of our employees. So these efforts, they work, and I think you're right, we have to bring this across the country.
I want to hear audience comments and questions, but Brent, one of the things you do in addition to working with a lot of providers is you talk to people in Washington a lot. And and help dovetail this conversation, if you can, or if it's possible, with the discussions that you're hearing in Washington. I mean, What do you think the mood is in Congress and in the regular, the agencies about these opportunities?
You're giving me the easy question. I figured that was the part. I was just there a couple of weeks ago and trying to. I think there's definitely a recognition of the long-term issues that need to be addressed. What you see, the struggle is what are the pay-fors in the short term? It's exactly the same discussion as we were hearing in just the previous session there. There's not much disagreement about long-term goals and providing care across the continuum. It is how to pay for it. Where does it come from, especially in the short term? I mean, that would be.
So for all the debate about the short term, whether we're going to do this or that, you think maybe there will be a consensus down the road on a more macro application of technology to improve? I mean,
I think so because the drivers are there. You can see it. You can see the dynamics in the population and the need for that. So the question is how long and what form? How long does it take and what form does it take?
yeah, I worry it might take a while.
And I would only say, Dave, the other exciting thing I think about technology, and I saw many people stand up and said you're an innovator. The other thing that we're really excited about is how innovative technology actually can help as a provider, help us as providers, restoring more time to the doctor and patient visit. And so I think that's really important for us as a provider, is how does technology allow our doctor and our patient to have more time together, more expression of empathy, which is really some of the core of healthcare. And it might be something we haven't talked about yet, but it's incredibly exciting, the technologies that are being developed to allow the physician, allow the doctor to be that doctor, the patient, and serve those needs.
Yeah, that is exciting. Who has comment or question? Anybody want? Okay, please, Dawn. Identify yourself and then get the mic too.
I'm Dawn Barber.
You're Dawn Barber of.
Dawn Barber. I co-founded New York Tech Meetup and more recently Creative Tech Week. I happen to know Chris Coburn at the Cleveland Clinic pretty well. But what I wanted to ask, what do you guys feel is happening at the education level in terms of technology? So, I know medical school is a long and arduous, task. But I'm curious, and I have no, I have no experience with that at all. But, is technology being introduced, and at what level, and where, and how, and should it, and will it, and all of this?
So I would just clarify that we did not know that, you and I did not know each other before that question, but that's a great question. And so when you think of the demands on healthcare, the changes of technology, it's going to be a changing definition of the caregiver roles. And so that has to be through education. One of the big things of that is it has to move from individual play to team play. So it has to be teams that take care of patients. What we have done, we've made a commitment at the Cleveland Clinic to education, and we're building a new health education campus so that at the start of education, medical students, dental students, nursing students all come together under one roof and start that team concept. One aspect of innovation that we're bringing actually is we're bringing the HoloLens technology to our anatomy teaching. And so we will actually start all anatomy will be done through a HoloLens. There'll be no more cadavers. And I can tell you many of our medical students are excited because that whole semester of gross anatomy, they weren't allowed to ever date anyone because they smelled like formaldehyde. And so yes. And so it really will promote the team play that we're looking for.
Yeah, maybe a related comment or ask you. One of the things that is kind of a macro topic for us, and I don't know, maybe in this room, but is how to attract the talent. So one is to educate and prepare them. The other is how to attract people who want to be part of what you're doing, because a lot of the skills, software, project management. I mean, it can. Those people are in demand everywhere, right? And so at this point, we've found, or one of the opportunities we found, because we probably compete with each other for some of the same talent pool, but is emphasis on our mission. We've found that to resonate in many cases, and that is to improve the lives of 3 billion people by 2025 and try to make that very clear and compelling. And, we found that helpful because a lot of times people have the skills, but they want to do meaningful work. And so for us to try to get that message out is something we really try to do. And I don't know if you...
I could not agree with you more. And what we talk about for the 51,000 caregivers that we have at the Cleveland Clinic it is about the opportunity to have meaning and purpose in the work that you do. And so we drive hard to try to provide them with the opportunity to have that meaning and purpose that every one of us desires. And so we do work hard on our mission. I think that's what attracts people to Cleveland. That and the fact that we are the NBA world champions is another aspect.
It's all about Cleveland.
Yeah. If anyone's here from Boston, we're looking forward to that too. But in addition, in addition to the meaning and purpose in attracting, it also allows us to retain talent.
Well, it's great to have people who represent organizations that have those kinds of commitments on stage, and thank you both.
Thank you very much.
Thank you
Thanks for the
having me.
time. Yeah, thanks, Dave.